The Seven Kingdoms needs a ruler loved by millions with a powerful army and the right family name.
Good luck finding him.
Who said anything about him?
I'm not going to stop the wheel. I'm going to break the wheel.
Good evening, Bahamas. You're tuned into MB12 Weekend, broadcasting from Cable 12 Studios on Robinson Road. Coming up tonight in news, BTC stands to lose millions because of pressure from international telecom companies. A man gunned down in the inner city. Business owners want VAT concerns addressed. How a mother overcame adversity and wrote her first book. Plus, MB12 giving you the opportunity to sound off on current issues. I'm Paige McCartney. We've got those stories and more straight ahead on MB12 Weekend. Welcome once again to MB12. BTC is expected to lose millions of dollars in long-distance revenue after two major North American cell phone companies threatened to pull out of the partnership with the nation's sole cell service provider. Jasmine Brown has details in this report.
Williams says that ultimatum came last month and added that since then, BTC executives have decided to comply with the request to cut roaming rates.
Canada-based Rogers Communications and U.S.-based AT&T Wireless are the two companies that reached out to BTC, according to Williams. In that candid conversation, Williams said both companies insisted that unless roaming rates are reduced, AT&T and Rogers would put an end to their customers roaming in the Bahamas.
And so almost with a gun to our heads, we had to reduce roaming rates.
The decision to reduce the roaming rates are expected to cost BTC more than a pretty penny, cutting into the company's profits. In fact, Williams says the projected losses would nearly cut roaming revenues in half, from $52 million a year to $25 million a year.
In fact, depending upon what will happen, we could lose in roaming revenues in the neighborhood of almost $2.7 million a month.
The BTC chief explained that in addition to losing more than $2 million a month, changing its billing system for roaming customers to suit the wishes of AT&T and Rogers will cost additional losses.
BTC present billing system is per minute, and so we charge you by the minute. If you speak for 50 seconds, then we run it up to a minute. BTC has to migrate its billing system to a per second billing. The loss of revenue to go from a per minute billing to a per second billing is $2.5 million per month. And that in itself reduces the effective rate of incoming long distance and incoming roaming by $300,000 a month.
The loss in roaming revenue comes as BTC officials are projecting that a second cellular company could cost BTC 30% of its market share. Williams says that would also work out to millions of dollars in lost business. Reporting for NB12 Weekend, I'm Jasmine Brown.
Well, police have launched an island-wide search for the suspects involved in an overnight shooting that left one man dead and another man and a woman in hospital. Reports are that a man and a woman were sitting in a car parked in the front of a home on Podolio Street shortly after 11 p.m. when 4 or 5 men armed with handguns approached them and opened fire, hitting the man several times before fleeing on foot. The man tried to drive to the hospital, but crashed the car on Montrose Avenue. He was eventually transported to the emergency room, but succumbed to his injury shortly after 1 a.m. today. A man and woman standing near the house on Podolio when the incident occurred were shot in the thigh and leg, respectively. They are said to be in stable condition. Anyone with information on this latest killing is asked to contact police at 919 or 328-TIPS. And police also have the mother and stepfather of a 1-year-old boy in custody following his death. Not much detail are given on this case, but police say the baby boy was brought into the hospital dead at around 9 last night. An autopsy will have to be performed to determine his exact cause of death. Meantime, the man and woman are said to be assisting police with the investigation. Well, despite what many have called the relatively smooth implementation of value-added tax, many issues brought up by members of the private sector have yet to be addressed. That's according to Chamber of Commerce Chairman Gowan Bowe, who says those issues were raised with the VAT department just last December.
The Chamber and Coalition is very concerned with is that we still haven't gotten what I would call that consolidated issues list responded to formally by the government.
Bowe says the overall lack of response to their queries does not inspire confidence in the process.
Not to say that that's going to change anything. I think it would create a level of calm and a level of confidence to say, well, we as an industry or private sector raised a multitude of issues, some small issues, some very large issues, and we expected and still do expect that the government respects that that's the issues that have been raised and they're formally responded to, so that whether it be on our website or their website, you have a document that says these are the matters and these are how they were addressed.
While he conceded that a handful of issues have been addressed over the last few months, Bowe insists the concerns should be responded to collectively. That was introduced on January 1st at a rate of 7.5%. The deadline for the first filing period was February 28th in the case of businesses making $5 million or more, and April 28th for businesses that make under $5 million. And a report submitted by Costa Rican consultant Sanidez Internacional revealed that more than 700 deaths in 2010 could have been avoided had those individuals had access to proper medical care. The report shed light on a number of inefficiencies in the public health care system and called into question the standard of treatment at public clinics and hospitals. The president of the Bahamas Public Services Union that represents government healthcare workers, John Pinder, said it's a shortage of healthcare professionals that's a strong contributor to the inadequate service in public healthcare facilities.
While some of my members may be guilty of providing poor service, but the services at PMH is really poor services. You take forever to get served. They don't take too long to register you, but you take forever to see a doctor. So I don't know who's responsible for that. Is it not sufficient doctors on staff? Is it not sufficient nurses there? What is the problem? We need to address that problem. There's no reason why patients have to spend 10, 12 hours at PMH before they see a doctor. And I think one of the reasons why they don't like to go to the clinics is they think my information only one doctor be assigned to a clinic.
Pinder is suggesting government consider partnering with the Cuban government on an agreement to allow Cuban doctors to work in special areas in the same way that there is an arrangement for Cuban teachers to provide specialized services in public schools.
As you know, there was a time when the Cuban doctor wanted to provide 20 doctors to, when I was talking to them for our medical health plan, but of course it was knocked down by the Medical Association because they, to some extent, don't want to accept that. But put your criteria in place. Cause those doctors to meet your criteria and allow them to help us with the situation we have here.
Health Minister Dr. Perry Gomez said earlier this week that while a report on national health insurance points to inequities between the public and private wards at Princess Margaret Hospital, the public wards do excellent work. According to the report completed by Sanidez International, patients between 18 and 64 who were admitted to the public wards at PMH are more than 5 times as likely to die than those on the private wards. For patients over 65, the likelihood of death in PMH is more than double on public wards than on private wards. You're watching the best in Bahamian news. There's more when MB12 Weekend returns.